Good morning, good afternoon, good evening, everyone, wherever you are in the world right now. I am the Plant Based Nutritionista, and I am here to inspire you to take your health back one meal at a time by eating more plants. As you know, my podcast, In the Kitchen with the Plant Based Nutritionista, is designed to build a robust community in health around each and every one of you by bringing into my kitchen experts and just, regular people too from the community to hear some of the conversations that I'm having with my mentors, my physicians, my colleagues, professors, faith leaders, family, friends, you name it. They up in my kitchen, y'all, either in person or virtually. So we have addressed so many things so far as it relates to our health, our wellness, our fitness, but we've focused a lot on nutrition, of course, but we've also dug into financial, occupational, psychological, mental health, spiritual health, policy, public health, all these things. You're probably saying, why? Well, it's because your health and your wellness are complex. And as you know, making decisions about your health and wellness is equally, if not as more complex. So through this podcast, I aim to inspire you and empower you with information to reclaim your health and well-being, one decision and one meal at a time. Today we have a phenomenal woman on deck, none other than the Dr. Karlita L. Warren. Dr. Warren has been licensed and certified as an athletic trainer for more than 20 years. She's got a PhD, y'all, in athletic training. She's also the founder and owner of the Kizo Effect. Now, this is a health conscious organization that helps to improve a person's quality of life through healthy lifestyle choices, injury prevention, recovery from injury, and health consumer empowerment. In addition, the Kizo Effect is a consulting firm for diversity, equity, inclusion, and accessibility. We don't hear about that accessibility too often, guys. But anyway, it's a consulting firm for DEIA in healthcare and health professions education. We definitely need it there as well. So, ladies and gentlemen, boys and girls, it is without further ado that I have the esteemed honor and privilege and blessing to present to some and introduce to others my friend and colleague, the Dr. Karlita Warren. Woo!
Oh my goodness. Thank you so much, Ethel, for having me. It is a privilege and an honor to be here with you. And oh man, you have me so excited right now. I love talking about health and wellness and having people be empowered to take control of their health. So thank you so much for inviting me today.
You are so welcome. I'm glad you're pumped, and I know our listeners are pumped too. So I just want people to understand like how you are just so fully accomplished. I like to say fully loaded. And I want to just dive right into the meat and potatoes of who you are and what you do. And through this discussion, we'll answer some basic things that our viewers might want to know and understand, like what is an athletic trainer? Yes, guys, it's more than just Sunday football. It's more than that. So you have such a uniquely cultivated background where you've recognized this gap or need in healthcare and you've managed to blend some very complex sciences to address these very key issues, not just for differently abled people, but for some of us able-bodied people as well. Can you tell us more about what this need is that you identified it, how you even recognized it, and what your vision is for bridging the gap with evidence-based and sustainable solutions?
Wow, that is a loaded question for sure. I would probably say that I first identified the need. It was twofold. So just briefly, I want to talk about what actually sparked my interest in healthcare and providing quality healthcare for individuals. And it was a family member, I won't say who, but there was a family member who him and my cousin were in a motorcycle accident. And I remember as a teenager, just going through that process of hearing about them having to go through rehabilitation because it was a very serious accident. And it really sparked my interest in healthcare. I thought at first I wanted to be a dermatologist. And then after them having that experience and hearing some of the stories of my cousin and her physical therapy experience, it really sparked my interest in rehabilitation and healthcare. Now, to be quite honest, I thought I was going to go to college to be a physical therapist after I decided to let go of the dermatology notion. And then at first I said, well, maybe I want to be a doctor, but I really was interested in the aspect of returning a person back to whatever their normal activities were or whatever the things were that they enjoyed doing. And so physical therapy is what I thought I wanted to do. And I went to college and was a pre-physical therapy major. And the school that I went to, what I enjoyed most is that they would allow us to do some observations, if you will, or some clinical observation rotations to make sure that this is something that we really wanted to do. And what we quickly discovered is, yes, I love rehabilitation. I love seeing someone recover from injury, but I was also extremely intrigued by just the examination and the diagnosis component of it. But we also discovered that if it was a child or if it was an older adult, I would be a little lenient and say, okay, you don't have to do that exercise if it hurts. And so they say, you might want to think about the athletic population or people who have a truly vested interest, like athletes do when you think about it, particularly professional athletes, to get back to whatever their sport is. And so I was introduced to athletic training in that regard. What ended up happening is in all of my experiences, and I'm sure we'll dive deeper into this a little later, but I noticed a gap of access to holistic healthcare or healthcare in general based on either location, so geographic location, finances, the accessibility in the sense of if it was when I worked in a high school setting, athletes not being able to go get the proper care that they needed or see the specialist that they needed because their parents had to work and sometimes work two jobs. And so they didn't have that accessibility to get to a physician's office at the designated times that physicians had hours. And so I started looking at that and looking at the lack of access and the inequities that were in healthcare. And it really took me in a different direction. While I absolutely love being the primary care person and treating injuries, evaluating injuries, I started veering toward some of the inequities in healthcare and the lack of access, the lack of diversity in healthcare, and I've been doing that ever since. So I guess identifying that need, as you asked, it was really looking at what are these factors we now know and define them as the social determinants of health, but what are these factors that are keeping people from having the access that they need to quality healthcare on a consistent basis? And so that's really where it began. And my vision to bridge the gap is to just understanding that I can't be all things to all people, but I can certainly start to make a difference and start to collaborate with other healthcare professionals who have the same mission and vision as myself, which is to make sure that quality healthcare is accessible for all, despite whatever the social determinants may be that they have. And so that's really how it started. That's how the Kizo effect got started, because I wanted to see what I can do to not only bridge the gap through the patient side of it and making sure that the patients have what they need, but then also collaborating with healthcare providers to make sure that we are doing our part to make sure that healthcare is diverse, it's equitable, it's inclusive, and it's accessible.
Wow, that was loaded. And I think that's really good because, primary care doctors, they can't do it all. And I dare say they can't think of it all. And not one thing you mentioned was about Sunday football or professional basketball. Like, you are talking about everyday people who get injured, who need to access rehabilitative care. Like the average person like me who likes to play sports as an adult that could get injured So I've had better outcomes with athletic training, but I have never made the connection like you did with overall healthcare. Like, I need every primary care provider listening to like perk your ears up right now, because this is actually something that can support your clinic, not just from athletic training, but even from the diversity, equity, inclusion, and accessibility piece. Like, think about it. Is your training 9 to 7? How can I get there? If I live in a rural community, like maybe I can't show up till 8 at night, right? Because I'm a farmer. Like, there's just so much there. And I think that's awesome. You've also done some research, some published things that you published around this. Can you tell us about what that is, and, how it even connects with us today?
Sure, absolutely. So, two publications that I have presently. One deals with racial and ethnic differences in the functional outcomes of stroke patients. And we just looked at what were those differences in their mobility scores or their functional outcomes and scores. And we did find some differences in the length of time that they were in inpatient rehabilitation centers, and in their overall recovery and their ability to either function and or their cognitive outcomes. So we are identifying that have been some racial and ethnic differences, but what we need to do now is take it a step further and look at what are the causes of those particular differences. And what we did find with the differences is that in our Black or African American population, and in our Latino or Latina population, there were some racial and ethnic differences in cognitive functioning and or mobility function or motor functioning after inpatient rehab, and that they had a shorter length of stay in inpatient rehabilitation centers. And so we're looking at it from the perspective of the patient, but then also whether there is an educational piece to bring some more culturally relevant or culturally competent practices into healthcare centers to make sure that the patient holistically is being cared for. And so that's the next step in the research that we did. We identified those differences. And the next step would be to now look at what we can do as clinicians and as healthcare providers to make sure that we are practicing culturally relevant, culturally competent care to ensure that those differences are mitigated. We also looked at racial and ethnic differences in traumatic brain injury with the same outcomes. So we looked at motor function and we looked at cognitive function and found some differences as well. So we would like to take the same approach and now look at how we can mitigate those differences as well. A lot of times what we're finding is that what may be necessary is to just go in and provide some professional development for healthcare providers to make sure that when we are discussing patient-centered care, which I do believe that all healthcare providers are focused on patient-centered care, but then making sure that we are considering those culturally relevant pieces and elements to that as well, because we can practice patient-centered care and not have it necessarily be culturally relevant. And so we want to make sure that we are integrating the culturally relevant components of that as well. And that may be for some that we include the family in the rehabilitation process as well. In certain cultures, the family plays a huge role in the decision-making for healthcare. And so that's just one small element that we can consider and think about. We can also think about how we're integrating the patient into their care or their rehabilitation plan and making sure that we're meeting the needs that they have or any concerns that they may have. When we talk about evidence-based practice for healthcare, it is certainly based on the most current literature or evidence that's out there, but it's also our own clinical expertise and the patient's concerns, their needs, and what their desires and wishes are.
Whew. Okay, small but mighty, right? So again, you're talking about stroke patients, and they could also suffer traumatic brain injury from the stroke, and then, blows to the head, traumatic brain injuries as well. It is so needed you hit the nail on the head that you can practice patient-centered care all day, but if you can't understand what I'm communicating to you through the lens of my culture, we are going to have differences in outcomes, differences in my progress to goal through recovery, differences in experiences, feeling like you hear me, you see me in my humanity. Like I mean, it's needed. And as someone who is uh on the, what do you say, upside inside, walking out of a third brain injury, I mean, clearly it's needed, because when I say I hurt and my doctor looks at me and drops his head like, oh, you're just making it up. No, I'm not making it up. I'm explaining to you to the best that I can with the limited abilities that I have to communicate as I recover. Something is off, but you're either treating me as the norm and what you think, or you're not taking me seriously. And you know what I realized throughout this whole ordeal, at least this third time? Most of the doctors treating brain injury have never had one themselves. So they cannot relate to what I am saying or to what a patient might be saying. And I think your work is so needed. And I hope that there are sponsors listening, funders listening to fund this, because this isn't an attack on race. It's an attack on a lack of understanding of how to communicate with someone who's different than you. Point blank. I can go to another country and try to push nutrition and ignore their culture and be met with resistance and a brick wall and never make any progress. Or I can take time to assimilate and understand how they communicate, what makes them thrive, just get to know the stakeholders. And you talked about training and professional development. That's so true. But my background in project management, change management, and just people behavior suggests that maybe we can take that a step further. Let's go in the room with the practitioner, with the clinician. And like, how we do time studies just for patient flow and all that. And let's see how they're interacting. And then at the end of each visit, because I've done this before too, for practices that wanted to do better, to say, hey, you did great communicating with the patient, but here's what I heard that you did not address, or you said it this way and I noticed their body language changed. Let me tell you what this means in the context of their culture. And I had patients from all different walks of life, but when you're that third eye in the room, if you will, you can see that. And being able to then, and you're a great communicator, communicate that back, like, hey, we're on the same team, try it this way. I had doctors say, no one has ever critiqued me and I wanted to just bawl and cry, or he's like, you basically told me to go to hell. And I didn't tell him this, but this is how he was trying, again, his culture, how he's describing it. It's like, you basically told me to go to hell and I did a terrible job, but I feel so loved. And I was like, yeah, so I didn't say that, but I basically was able to address a concern that's been reoccurring in patient notes and staff complaints in a way where he still felt seen in his humanity. And now we're dealing with other issues that's causing that. So I just think most people don't get up wanting to demonstrate racial differences, but unfortunately they do, because it's ingrained inside of them. They don't know it's there. They begin to bias, like unconscious bias and all that jazz. So I feel like I don't want to talk anymore on this because I can go on and on. But the work you're doing is so needed, and I've lived it. I think that's where this passion is. I've lived it now, twice as an adult, and it's needed. So again, to the funders and sponsors who are watching, I don't care if you make cotton balls or I don't know, book covers. This is such good research, and we would love for you to get behind it. Okay, I'm gonna get off my soapbox.
Well, thank you, because I do have some other ideas that I have been working on. I guess about 2 years ago now, maybe it was in 2021, I had the privilege to be a part of the Center for Health Equity Research Institute, SHARE Institute. What they do in the SHARE Institute is just teach us how to identify funding for community health equity research that we would like to do. And I wrote a proposal and a specific aims worksheet to continue my traumatic brain injury research, looking at racial and ethnic differences. I'll just leave it there. So I am looking to develop this a little further. And again, not to just point out the differences, but certainly to look at how we can then begin strategy to decrease and minimize those differences and make sure that we are providing that culturally responsible care to our patients to just try to mitigate any long-term effects that may occur that could be related to areas that we're not approaching with regard to diversity, equity, and inclusion, health equity, making sure that we're not being exclusive in our practices, and just making sure that we are meeting all of the needs from a holistic perspective for our patients to make sure that they recover completely and return to optimal health and wellness and get back to whatever their activities of daily living may be, or if they are participating in sport, making sure that they're able to do that without any limitations or restrictions. And you said something funny. You said a lot of the physicians haven't had brain injuries themselves, and I chuckled a little bit because I said, well, I haven't had one. Well, technically, there was a thought of me having a concussion a couple of years ago, but we don't necessarily have to experience the same injury to still have empathy and to make sure that we're practicing from a holistic perspective. And so we just want to get to the point where we're all, as healthcare providers, practicing holistically. And in culturally relevant ways, as I said. And that just really requires us having the mentality that goes beyond what our healthcare system allows, if that makes sense. So, the way our healthcare system is set up, we get the patients in, we get them out quickly, but we might have to take a little extra time. So it may take 10 or 15 minutes longer when we are during our initial examination or evaluation or our follow-up appointments, so that we can clearly identify what the prognosis is for that particular patient and articulate that to them, and then collaborate with them and the rest of the healthcare team to make sure that they are receiving optimal care.
Well, amen, touche to that, all of the above. You're right. We don't, and I hope that's not what I was implying, but it's you're right. You shouldn't. I guess one is more empathetic when they've lived it than when they've not lived it. But you're absolutely right that it shouldn't take that for empathy to be displayed by practitioners. And I'll leave that there. But that you're absolutely 100% right. And that's where that training comes in. And maybe it's the role play videos. They have corny videos in training, but they really do paint the picture in very exaggerated ways. So I 100% support that, because I can tell you, I wouldn't wish a brain injury on anyone, nor the recovery process. It's a lot. I'll just say that. And especially our stroke patients. Like I'm a part of a support group, and I thought I was having issues. And then I met stroke patients. I was like, that never even crossed my mind. Here I am crying and whining, and these people really got some serious concerns, or their mobility, like you said, has been impacted. But regardless, that empathy goes a long way with recovery. When you feel, and this is what people don't realize, that how our disease management physicians are trained, or medical doctors are trained. They're trained that if you believe it, your patient will believe it. If you're confident, your patient will have confidence. So even if you're wrong, and even if you're not sure, you better walk in that room and be confident, because studies suggest that improves health outcomes or recovery outcomes. The part that makes me cringe is, like, we're talking about disparities, and if you believe something about me that may not be true, or narrative that may not be true, and you come in with that confidence, and I can pick that up, which I can, then there's a disconnect. So now I'm looking for the next doctor who can help me because I don't think you hear me. I don't think you see me, which was a part of my experience. This ain't about me today. I just think this is a very needed discussion when we're talking about something as delicate and complex as healing the neurological system, which touches so neuromuscular, really, it touches everything. And we're seeing now, one of my first speakers was a neurosurgeon. Mm-hmm. I mean, we're starting to see strokes in 30 and 40-year-olds, right? So you don't have to always have a blow to the head. Mm-hmm. It can be your diet, right? That can lead to now you needing an athletic trainer. And you want that person to be empathetic and recognize, all the different things that we're talking about. This is awesome discussion.
Yes, and that's why implicit bias training is extremely important. I know that in our current state of affairs in our society, we have certain states, and we definitely don't have the time probably to get into that, but we have certain states who don't see the importance of these discussions or trainings, but it is completely important because all of us have some level of bias, implicit bias, just based on our previous experiences in life. And sometimes they do, if we're not careful, infiltrate our interactions with others. And so when it comes to the healthcare profession, it is important for us to have self-awareness and know what our biases are so that we can control them and mitigate them and not allow them to have an impact on how we interact with our patients, how we interact with our colleagues or our peers, to ensure that we don't do any harm. If you are a healthcare provider, you've taken some type of oath to first do no harm. And that does include also, in my opinion, checking our biases at the door so that we can do that. If you've read any of the literature, you know that there are some beliefs about different race and ethnicities with regard to pain tolerance, for example. And so we want to make sure, or, chronic illnesses or conditions or who are going to experience them more than others. And so we have to make sure that having that knowledge doesn't allow us to have preconceived notions about patients as soon as they walk through the door, but that we truly treat people as individuals and see each patient as an individual patient and make sure that we are treating them and evaluating them according to whatever it is that they have, the information that they've disclosed to us as we start our examination process. While we know that certain illnesses or injuries or conditions are more prevalent in certain groups of people, we still need to take an individualized approach. And so having the implicit bias training or any other training that deals with diversity, equity, and inclusion is extremely important. Microaggressions training, for example, how to recognize it and how to address it if it occurs, or how to not be a recipient of it, or the, for lack of a better word, perpetrator of microaggression. So there's a lot of things that we have to consider as healthcare professionals, but as you said, sometimes we are unaware. But having companies like the Kizo Effect and other individuals come in to help do workshops and trainings can offset that.
That's good. So what type, I know you're healthcare and in health education professions. I was just at a ground rounds at a local medical university here where we're talking about that medical education and why it's important to really integrate at that level, because that sets the tone for the industry. Mm-hmm. Right. So we're still talking about breastfeeding for residents and having spaces to do that, and here we're talking about the athletic training component of this and what that looks like. So, what are some companies or industries or groups, I don't know what the right adjective is here, that should be reaching out to you or that you would like to work with, because this is so important if we're going to turn the tide we can attack the federal beast, right? That's an uphill battle sometimes without a paddle. Or we can do a grassroots effort and start with what I like to say our children, our youth, our young adults, those of us that are in training for different clinic professions. Like, who do you want to hear this message? Who do you want to reach out to you to get the support? Because I believe the Kizo Effect is doing great work. I know we spent some time on traumatic brain injury and stroke, but you also talked about some other areas that, it just doesn't matter, I guess, what the diagnosis is. As what I'll just sum it up that way. Who do you want to reach out to you? What areas should we be focusing on? And for those of you watching, come on, let's send this video out because this is important work.
Yes. Well, first, before I let you know specifically for the Kizo Effect, I will say that health professions education, particularly those that I know of and have worked with, be it athletic training education, medical education, nursing, physical therapy, and occupational therapy are organizations or academic entities that I have had the privilege of working with. We are all working to ensure that, as you said, on the grassroots level, in our academic programs, we are allowing the opportunity for diversity, equity, inclusion, access, justice to be integrated into our academic programs. And a lot of the health professions that I just mentioned have academic standards in their educational programs that require the integration of diversity, equity, inclusion as well. And so to that end, we are looking or working hard to make sure that we are in our academic programs having our students address these issues early through either patient simulations, education, for example, to know how to make sure that they are treating our patients, or excuse me, evaluating our patients from a patient-centered, culturally relevant perspective. And so specifically in athletic training education, we do have diversity, equity, and inclusion standards embedded within our academic standards to make sure that we are teaching them before they come out. And as a former educator in athletic training programs, I can tell you that I would integrate it throughout all of my evaluation courses. So I taught a lot of the orthopedic assessment courses, and I would integrate that in there. And if I did problem-based learning, for example, with my students, and we did case studies, the case studies would always have culturally relevant pieces a part of it, in addition to whatever the injury or the condition may have been, to help the students know how they would approach it from that perspective as well. And then we would, as a group, through role play and other type of improvisations, we would look at how our students were treating the patient or evaluating the patient. Did they hit all of the aspects of the holistic evaluation? And I would have my students provide feedback to each other as well, not just hearing it from me only, but letting the students look at it. We had other patient simulation type of environments where they would look at two students doing an evaluation through a glass mirror and then provide feedback there as well, or record it. During the pandemic, it was huge. I had my students do recordings because all of the classes were online. And I would send the recordings out, or we would post them in our forum, and the students would provide feedback that way. So we are making sure that we're integrating it from that grassroots level, as you mentioned. So I just wanted to mention that first. Now, to answer the question about what types of organizations, definitely academic institutions. We service academic institutions to go in and either provide trainings or workshops, seminars. It could be virtual or in person, to just talk about how we can avoid microaggressions in clinical care, or avoid microaggressions in health professions educational settings, how to recognize and mitigate implicit bias, for example, how to occur relevant physical examination for patients. So academic institutions, we service academic institutions, government agencies, hospitals, inpatient and outpatient clinics, private practice, private entities, I can go into the armed forces or the military, just any environment where you're going to be engaging with others, be it direct patient care, if it is employment settings, or public entities, for example. We do workshops and trainings for anyone that is interested in learning how to become more diverse, how to have more inclusive practices, or to make sure that they are being equitable in their practices. I can service them all.
That's awesome. I didn't even know about all those locations, so that's great. And it's just, I just want y'all to hear this is more than just the training piece. It literally is integrating into curriculum design, policy design, patient care simulations. That's remarkable. So I really hope that people hear this and say, you know what, it's time. Regardless of what is happening in our nation, humanity is important. And let's figure out how we can do this well. That's really, really, really good. So, I got to ask this question, right? Is there a place for eating more plants, and all of this? Because I'm telling you, my sister says, Heather, that is not the answer to everything. And I always say, yes, it is. That's the answer to everything. That's how I recover so well. But okay. So, in all that you're doing, I don't know if it fits on the employer side, when you're working with the actual practitioners or the patient side as a clinician yourself. Where does eating more plants fit in, and is it important?
Okay. Absolutely. It is absolutely important. Nutrition is always important. And with I Eat More Plants, there certainly is an avenue for you in the world of athletic training or healthcare in general, just because one size does not fit all. Let me say that first. And I do believe, even with I Eat More Plants, we know that you are looking at helping people improve their quality of life in its totality, but then also through proper nutrition. And so when we and that segues me into when it comes to exercise recovery, whether it is the person who is not injured, but they do exercise, either high intensity exercise or even moderate exercise, for that matter, on a consistent basis. Part of their exercise recovery has a nutritional component to it. And then those who are elite level athletes that athletic trainers will work with as well. Nutrition plays a huge role in recovering from exercise that way, and or recovering from injury should an injury occur. So there is definitely room for I Eat More Plants. What we need to understand, and I'm sure you're aware of this, but for those that are listening, proper nutrition definitely does aid in exercise and injury recovery. And it requires us to be able to think about how we balance our energy, and we get our energy from food, from food sources through our caloric intake. And so just balancing out that energy becomes important. So eating too little or eating too much can have deleterious effects. So we want to make sure that we are looking at how much we're eating and what we're eating to that regard. So we want to integrate a variety of whole foods, which are going to include our plants.
Yeah,
So
yeah.
our vegetables, our fruits are extremely important. Our whole grains. We're looking at healthy fats is what we're going to need to integrate into our daily eating and the food selections that we choose. And so that is where I believe I Eat More Plants can come in, particularly for those athletes or patients who are not sure about, just how to integrate more into their diets. Depending on who you talk to, there may be some that say, in order to have optimal performance and more muscle gain and bulk, high protein, high protein, high protein. But we automatically think one thing, right? We'll think, oh, high protein, more meats. And so I think that the opportunity to educate multiple protein sources can definitely be something that iEatMorePlants can do. In addition to showing the balance of the whole grains, for the complex carbohydrates that are needed for energy to sustain long bouts of exercise or to sustain short but high intense spurts of exercise as well. So there's definitely an opportunity for nutritional education to come in and show them how they can balance all of that out. But it definitely deals with energy balance, integrating more varieties of whole foods into the diet, avoiding foods that are high in simple sugars or as well. So teaching them about that. We definitely advocate for individuals to replace electrolytes, right? When they have high intensity or long bouts of exercise. And so people will automatically assume, let's get Gatorade or Powerade or those types of juices or to replenish. But there are certainly a plethora of other ways that they can replenish those electrolytes as well. So having you all come in to be able to talk about that and educate people in that regard would be good. Also, when we think about nutrition and exercise recovery or an increased risk of injury, when you think about it, if glycogen stores are depleted, okay, they won't be able to perform as well. And that could increase a risk of injury. If they're dehydrated, for example, that can increase risk of injury and they won't perform as well. So having you or having individuals come in to talk about how that impacts them, or low, if they don't have enough iron in their diet, for example. There's a lot of things that definitely can be introduced and taught and to help them understand that everything that I just mentioned can come through plant sources. It doesn't always have to come from other sources. And so definitely there is room for iEatMorePlants when it comes to that.
Yes. Yeah, you listen, thank you for that, because I always say nutrition is the foundation of life. And we spend so much time on athletics. And as you were just talking, I was like, hello, basic chores around the house. If your iron and vitamin D are low, they are so important. I mean, that takes me on a whole osteoporosis prevention path, right? Just in that. But do you have the energy you need to do the things that you have identified you value in your life to prevent injury? We can go back to the older adult population and talk about preventing falls. Do they have strength to stand up straight? Are they doing exercises safely? Do they have the nutritional support to do that? It is all interconnected. And I think it's really important that we get back to basics and get back to what really we know works, which is eating food that is alive when we put it on our plate, essentially. And because in my opinion, that's just how we were divinely designed, and that's how we thrive best. And I can't, like you said, say it enough. It's just so important for injury prevention and recovery. And you can be eating all the plants in the world and still, trip and fall or get into a car accident, or, you can't prevent every injury, but we're talking when we say injury prevention, like when you're engaging in intentional physical activity for recreation or competition or whatever like that. But that's really important. So this message, it doesn't just touch athletes, it touches all ages. Even for our children, like, are they meeting their growth milestones? So, but we'll be talking about more of that on Friday, actually, at the nutrition masterclass. I hope the parents come out, so we won't go there.
And it's just important to remember. It's just important to remember that poor nutrition is what could potentially lead to the increased risk of injury. But proper nutrition helps with recovery. And so that's the most important thing. And when we talk about diversity, I wouldn't be doing due justice if I don't talk about the diversity of nutritional needs or desires. And so we do have athletes that practice a plant-based diet only. And so it becomes important for us as healthcare providers to also know and have knowledge about what their specific needs will be. That is inclusion right there as well. That's equitable practices when you consider that as well. And where I may not have all of the knowledge, then I should have resources at hand. iEatMorePlants is a resource, right? So we want to think about it to that end as well. Poor nutrition could potentially lead to increased risk and injury, but proper nutrition helps us recover from those injuries. And that can be, as you said, the physically active population, or it could be sedentary individuals as well. But the most important thing is knowing that we need to meet the needs of all individuals. And we do have athletes who practice plant-based diets. And so it becomes important for us to be knowledgeable in that area as well, or to know who to refer them to if we don't have the specific knowledge there.
Wow, ladies and gentlemen, she just closed us out perfectly. And that's it, right? We can't expect our primary care doctors to have all the answers, because they don't. They have so much that they're managing. But like you said, having those resources, knowing who to connect with, and it's okay if you don't know the answer. That's why there are so many of us who have passions to do different things so that we can work collaboratively, comprehensively together, like you're saying, to be inclusive and ensuring everyone's leading, the best life that they possibly can. You have been like a trendsetter in this podcast community. Thank you so much for your time, your commitment to be here today to share with our community. How can people reach you? What is your website? And we'll put the details in the description, of course, for this. But where can people reach you today if they wanted to connect?
Sure. So the website is www.thekizoeffect.com, and that's TheKizoEffect, all one word.com. We are on Instagram at the Kizo Effect as well, and on Facebook, the Kizo Effect. If you'd like to send me an email, you can send it to info@thekizoeffect.com.
Awesome. Ladies and gentlemen, Dr. Karlita Warren, thank you so much for your time today. We appreciate you for joining In the Kitchen with the Plant Based Nutritionista. We are here to inspire you to take your health back one meal and decision at a time by eating more plants. Take care.
Thank you. Have a great day.
You're welcome.